Hi friends, how are you? Many students have asked me, teach me anatomy from basics. So here I am.
Audio Jungle.
So today our topic is introduction of anatomy. So what are the contents we are covering in this video? First, definition of anatomy, branches of anatomy, anatomical planes, directions, body regions, positions and movements. We have to understand what is anatomy. Ana means up, tomy means cut. Anatomy means upper cut. If you are doing any cutting, that time you have to know what are the structures present in under the body. Definition of anatomy. The anatomy is defined as a structure of body parts and their relationships to one another is known as anatomy. If you know well anatomy, you have to know every structure, where it is located, its position, shape, everything you have to know. Then only if you do any surgery, if you want to do cut, that time you will not damage any organs and vessels. That's why you have to study anatomy. Next, branches of anatomy. The anatomy is divided into several branches. The first branch is gross anatomy. The gross anatomy is also known as cadaver anatomy. This anatomy we can see with our naked eye appearance. This anatomy is useful in cadaver dissection and preservatives. This gross anatomy is divided into three parts: regional anatomy, surface anatomy, and systemic anatomy. If you see the regional anatomy, all structures in one part of the body. If you see this picture, you can observing here one head, thoracic region, abdominal region, upper limbs, pelvic region, and lower limbs. This is the regional anatomy. That regions is divided into many parts. Next, surface anatomy. The surface parts located by surface projection by point markings very useful in clinical practice. This surface anatomy is useful in clinical practice. Here if you see the thorax and abdominal area, you are observing it here Gifford process, here jugular knots. This surface anatomy is help for clinical practice because of for listening any sounds, for any redness, we have to understand which organ is affected. In through surface anatomy, we can observe these problems. Next, systemic anatomy. In systemic anatomy, that anatomy is divided into systemic patterns. For example, cardiovascular system, respiratory system, reproductive system, nervous system, excretory system. This type will come in gross anatomy. Next, living anatomy. In living anatomy, you can see inspection and palpitation. Inspection means we can observing, for example, breathing. If any person is breathing means we are not seeing that nose part. We are seeing thorax region. In breathing, this thorax region is increase and decrease. The doctor will observe in this area. Next, palpitation. Palpitation, for example, one patient have a appendicitis. If you see the right iliac part, appendix will be there. In that appendix in right iliac region, if you touch, you can feel tenderness because of appendicitis. In this living anatomy, you can observe this inspection and palpitation. Next, anatomy. Developmental anatomy. Developmental anatomy is also called embryological anatomy. In this anatomy, we can study of prenatal developmental changes. Before birth, how that embryo is developing. We can study in developmental anatomy. Next, microscopic anatomy. This microscopic anatomy we can't see with our naked eye. we can see with microscope. This microscopic anatomy is divided into two parts: cytology anatomy and histology anatomy. Cytology anatomy is study of cells. Histology anatomy means study of tissues. I forget one thing. Forensic anatomy is also there. This in forensic anatomy you are seeing many movies. In that movies you can see forensics. This forensic anatomy is helps for sex determination and age determination. Next, specialized branches. The specialized branches divided into three parts: radiographic anatomy, molecular anatomy, and pathological anatomy. Radiographic anatomy. In radiographic anatomy, study of deep organs, because we can't see with our naked eye. Inside of the body, we can observe through only imaging. So, we can study in radiographic anatomy organs and bones using radiographs, ultrasonograph, magnetic resonance imaging, and computerized tomograph and computerized axial tomograph. Computerized axial tomograph is helps for tissue imaging, like deep into the tissue. This divides tissue into the slice. If you see this image, this is the pelvic region X-ray. Next, molecular anatomy. Molecular anatomy is a subcellular level of anatomical structures are studying. For example, like gene, like organelles in cells, we can study in molecular anatomy. Next, pathological anatomy. In pathological anatomy, we can study structural changes caused by diseases. If any disease is causing, how, for example, like hepatomegaly, cardiomegaly, these organs are increasing their size. If any tumor is forming, like aneurysm, these types of everything will comes in pathological anatomy. In radiography anatomy, you can observe like fractures, tumors, etc. In molecular anatomy, you can observe like organelles problems. In pathological anatomy, that structure is changing their positions or their increasing size, we can observe in pathological anatomy. Next, we are going to see the anatomical planes. If you see this picture, you have one body is there, and it's some bodies are cutting their parts. This is the anatomical planes. This is imaginary planes. We can imagine. First one, median and vertical plane. This median vertical plane passing through center of body divides into two equal halves, right and left. If I cut median part of my body, it's divided into two equal parts, right and left. Sagittal plane. This sagittal plane parallel to median plane along sagittal sutures. As I told you before, this is median plane. If I cut, if parallel to the median plane, you can have sagittal plane. Then after parasagittal plane, parallel to sagittal plane, it divides body into two unequal left and right halves. This is median plane. This is sagittal plane. If you see the parallel to the sagittal plane, you can call parasagittal plane. Next, coronal plane. Coronal plane passing through coronal suture divides body into anterior and posterior halves, front and back. If I cut, for example, if I cut this cup like this, if I cut like this, you can observe anterior part and posterior part. This is anterior part, this is posterior part. This cut we call coronal plane. Next, transverse and horizontal plane. This transverse horizontal plane will cut upper and lower halves. If you see this picture, this is the mid plane, this is the coronal plane, this is the transverse plane. Here this picture is very good. First one, this is the sagittal plane, that means median plane, and another one transverse plane. It divided into upper part and lower part, and this is coronal plane. It divides into anterior part and posterior part, front and back. Next, anatomical directions. In these anatomical directions, we can observe superior and inferior part, cranial and caudal, near to head and or tail. If you see this picture, this is the superior part, this is the inferior part. If you see, the superior means cranial part, means head region, and inferior part means caudal region, that means lower part. Next, anterior or ventral and posterior or dorsal, nearer to front side or back side of the body. If you see this image, you are observing this front part, we call anterior part. Anterior part and ventral part both are same. If you see the back part, this is posterior part. Posterior or dorsal, both are same. This cranial is there, right? We call superior part. This caudal part is there, right? We call inferior part. Next, medial and lateral. Nearer to or away from median plane. If you see this picture, if I cut midline, you can observe this is the in umbilical part. You can observe this is the medial part. If away to the medial part, we call lateral part. That means this is medial part and this is lateral part. This is medial, this is lateral part. This is lateral part. Next, proximal and distal. With reference to limbs only, nearer to the root of the limb or away from it. If you see this image, here this root is attached with body, then it is called proximal. Away to the body, it's called distal. That means this is the proximal part and this is distal part. This is proximal part, this is distal part. This is proximal part, this is distal part, like this. Next, ipsilateral and contralateral, same side or opposite. Ipsilateral means same side, contralateral means opposite side. Superficial and deep, nearer to surface or away from it. That means this structure is superficial. If you are going to deep, means it is deep structure. Next, in limbs, if you observe in limbs, ulnar side and radial side, tibial and fibular side, we call this is this structure. This is radial side and this is ulnar side. If you see in leg region also, you get tibial part and lateral side you get fibular part. Next, palmar and dorsum. This is dorsum area and this is palmar area. See, in this image, you are observing superficial part and deep part. Superficial means upper area. If you are going to the deep, you can get deep area. This is the median part. If away to the medial part, you get lateral part. This is palmar, this is dorsal area. This is proximal and this is distal. Now, body regions. If you see the body regions, you can see the scapular here, lumbar and popliteal and calf area. Next, this is the buccal area, this is brachial area, this is antecubital, and this is abdominal area, this is umbilical, and this is inguinal area, and this is femoral area. These are the body regions. Now we are going to see the positions and what are the clinical importance of these positions. First one, anatomical position. If you see the anatomical position, you can see this type of features. You can see like body standing erect, arms by the side. If you see the face and eyes and palms, they are facing forward and lower limbs are parallel. Toes are directed to the forward. This is we call anatomical position. Positions is divided into many types. First one, supine position. In supine position, body in lying down position facing backwards. If you see the like yoga, you can see savasana. This savasana we call supine position. This supine position is gives relief. Next, prone position. Body in lying position face forwards. This is the prone position. This is the supine position. Lateral position. If you see this image, this is the lateral position. Side lying position, left side major portion of the body weight on the dependent hip and shoulders. What are the clinical importance in this position? This position is useful for enema, insertion of suppositories. For checking rectal temperature, we can use this lateral position. Next, Fowler's position. Fowler's position means this type of position. Upright position with the patient in a sitting position in the bed with legs resting on the bed. If you see the Fowler's position clinical importance, it relieves breathing difficulty, relieves tension of abdominal sutures. If any patient have any surgery in abdominal area, after surgery we are doing sutures, right? These sutures we can't give tension, because if we give tension means the sutures will tear. So that's why relieves tension on the abdominal sutures, and it relaxes large muscle of the back and drainage of abdominal cavity. We can give this position, Fowler's position. Next, lithotomy position. Lithotomy position means this type of position. The patient lies on her back, the legs are separated and thighs are flexed on the abdomen. If you see the lithotomy position for pregnancy, we are giving this position, and vaginal examination, pap smear, surgical procedures for genitourinary surgeries, we can use this position. Next, knee chest position. Patient lies on the bed in such a way that the knee and chest rests on the bed. If you see this image, this is the knee chest position. This knee chest position is helps for examination of vagina and post posture exercise. Next, movements of joints of the body. Flexion and extension. That means this is flexion and this is extension. To bend and to stretch. Next, adduction and abduction. To move towards median plane and away from it. Medial rotation and lateral rotation. Circumduction, pronation and supination in forearm alone. Inversion and eversion in foot alone. Elevation and depression. Protrusion and retraction. Opposition and thumb alone. If you see this image, this guy bending his head, so we call this is flexion. Normal position, that is extension. If I do like this is hyper extension, right? This is extension, this is flexion, this is hyper extension. If we see the hand, this is the flexion, this is the extension. If we see the lower limb, here this is the flexion. If we raise our leg, it is flexion. If we raise our leg back side, means it is hyperextension. If you see this image, this is the lateral flexion, right lateral, left lateral. Next, this is the plantar flexion and this is dorsiflexion. This is thumb opposition. If you see this image, this person is moving his leg away to the medial plane. So this is abduction. If towards it's taking, means it is adduction. Next, if you see this girl, she is rotating her hand. If you see the circumduction, the body parts moves so that a cone shaped is outlined. It is called circumduction. Inversion. Inversion means that sole of foot turns inwards. like that means that foot will be like inwards, it will move like this. It is inversion. Eversion means it goes, it is the eversion. If you see this image, we call this is supination and this is pronation, because as I told you before, this is the radial side, this is the ulnar side. If you see this image, dorsiflexion, plantar flexion, this is the adduction and this is the abduction, this is the flexion and this is the extension. Thank you for giving this opportunity to share some knowledge about anatomy. If you like this video, subscribe my channel, press bell icon. If you have any doubts, please comment. Thank you.